Good morning. And for those participants whom we have from many different time zones, good afternoon and good evening. I'm Rosemary, the CEO of Mellow Parenting, and it's my privilege to welcome you all to this exciting global event. Usually I feel like an air steward pointing out the fire exits, explaining what to do in the event of an incident. However, rather than me flapping my arms about as usual, you know what to do because you're in your own home environment or work environment. But there is some housekeeping I would like to mention. Can you please write your name and the country you are from? If you just right click on your image, and then write your name and where you're from. And can I please ask that everyone mutes themselves? And we would also prefer that you switch your camera off because it helps with video optimization. And we have got a number of videos which I feel are really good. So please do switch your camera off. If you have any questions, our chat facility will be monitored by the lovely Josh. So please ask any questions through chat and we will get back to you, or we will pass them on directly to the speakers. Now, an important point, we will be using Mentimeter. If you have another device with you, a tablet, a phone, please go to menti.com and insert the code 1563197. The number is up on the screen, the top of the screen. Go to www.menti.com and use the code 1563197. Now, from the initial concept of this event, it has grown arms and legs, and it's much bigger, therefore, than we anticipated. So it's now packed. We've got lots of people attending. We've got lots of very exciting speakers and videos. I think we are going to run on in time. I'll do my best to keep everyone on time. If you do need to go, please go. But I think we're going to run on about 15, 20 minutes. Do excuse us. We are bringing you lots of information. Enough from me. I'd like to introduce you to our magnificent chair for this session, Professor Campbell Paul, a consultant infant psychiatrist from the Royal Children's Hospital in Victoria. Campbell, over to you.
Thank you very much indeed, Rosemary, and it's an absolute pleasure to be with you here. I think I'm just going to switch computers as we're talking. There we go. So, greetings, and it's a real privilege to join you all today. I'm here in Australia. I'm on the surf coast in a little hamlet outside Naarm or Melbourne, and I'm on the lands of the Wadawurrung people who've been owners and custodians of this land for thousands of years. I'd like to acknowledge the elders, past, present and emerging, and show my respect for the culture which has been continuous in this land called Australia for some 60,000 years. I've been very privileged to work with and learn from many First Nations people here in Victoria and other parts of Australia, learning about families and infants and young children and the impact of the care of family in the face of profound intergenerational trauma that followed past colonialisation. So, again, I'd like to acknowledge the traditional owners of the land where I'm talking to you from, also to acknowledge people with lived experience of mental ill health and their supporters, and those who are working like each of you and like the people from Mellow Parenting and from the Homestart Worldwide group who are doing such amazing work with infants and families. So again, welcome. I'm an infant psychiatrist. I work at the Royal Children's Hospital and the Royal Women's Hospital in Melbourne. and I'm also president of the World Association for Infant Mental Health. And from that perspective, from the perspective of the World Association for Infant Mental Health, it's an absolute delight and honour to be working with you. One of the key goals of WAME is to see how we can be part of the process of supporting infants and their families who are struggling in diverse settings and diverse countries and places around the world. It's a big challenge, but it's such an honour to be working with you today, with Mellow Parenting and with Homestart, who've taken some huge steps to work with vulnerable families and babies around the world, starting from Scotland, which is important. I think one of the most important export of Scotland, I think, has been people, and has been talented people and talented ideas. Today is Robert Burns' birthday, and Robert Burns was a famous Scottish poet, and he wrote a lot of poems. He was a great advocate for equality of man and woman, one of his famous poems was "A Man's a Man for All That," which again takes down social hierarchies and brings people together. He also had a number of relationships and a number of children, and wrote quite a few poems about babies and children. I'd like to quote from one of his poems, which is called "A Poet's Welcome to His Love-Begotten Daughter." There's a daughter born out of wedlock. And I'll just quote a few stanzas. "Welcome, my bonny, sweet, wee daughter. Though you came wee and unsought for, and though your coming I have fought for, both kirk and choir, yet by my faith, yet no, you are not unwrought for, and that I shall swear. Lord, grant that thou may inherit thy mother's person, grace and merit, and thy poor worthless daddy's spirit, without his failings. 'Twill please me mere to see thee hear it, to take it in, then stock it melons. For if thou would be what I would have thee be, and take the counsel that I give thee, I'll never rue my trouble with thee, the cost nor shame of it, but a loving father to thee, and brag the name of it." I thought Burns introduced us in that poem to the role of the father, and I think that'll be one of the important things that family partnerships that Mellow Parenting have been working on. I know it is. But the father, the mother, the baby, siblings as part of a family, but equally importantly, that broader network, the community, not the critical choir or the priest who is denigrating of variations in family, but agencies like yours, Mellow Parenting and Homestart, who are there uncritical but supporting and working with families in the real world. From WAME, a big welcome from me personally. Thank you very much for inviting me, and I'm very pleased to be part of the proceedings today in a little way. As I said, I work primarily at the Royal Children's Hospital and at the Royal Women's Hospital. So my introduction to infants and families, apart from being one within one myself as a young child, as an infant, as a child, as an adolescent, and now as an older adult, a grandfather too. But my real introduction to families who are having difficulties and struggle was in the context of a paediatric hospital. And that was an absolute privilege to be working alongside nurses and doctors who are seeing sick and troubled children, and children and families, infants and families who present with developmental and mental health problems. And that's been my privilege over the years. I was inspired by Anne Morgan, who was a paediatrician, a Welsh woman, who was absolutely devoted to understanding infants, young children, and their parents, and quite an inspiration for me. Another inspiration has been through Kevin Nugent and Barry Brazelton and the newborn behaviour observation. And we may have an opportunity to talk a little bit more about that, and you may already know a lot anyway. But it's a very brief intervention which helps us introduce the baby, the newborn baby in the first months of life to the parents, to share with the parents what the baby can do. And I think that's what each of you, I'm sure, are doing in your own work, is helping parents see the baby as a little person, as a real person, with their own thoughts, feelings, their own wishes and desires, and their intense fascination with the world and with relationships. And also to help parents know what to do when the baby is struggling, when the baby is shut down, when the baby is avoidant, when the baby is not feeding or not sleeping, when the baby is crying mysteriously or inconsolably. That's, I'm sure, important work that you're doing, helping parents see their baby as a little person whom they can get to know. And in doing that, get to know themselves as people. Often the people we're working with, whether it's in the paediatric hospital or in the community or with child's protection services, are parents who've got their own serious trauma. And that's a real job for us to do, to provide non-judgmental, constant and effective support. So I know that's what you're doing, but it's a jigsaw, as the theme of the session is today. We're going to establish what the frame is now. And our first presenter, actually, I don't know, Rachel, did you want to say something just now first?
Yeah, just a reminder, we're going to be using Mentimeter. So yeah. if you're able to go... Yes. Yeah, if you're able to go to Mentimeter, www.menti.com, and we're going to find out a bit more about who's with us, and then we'll go on to Gus after that. Yeah, so this is the Mentimeter. Good morning, everyone. That's great. So if you go to mentimeter.com, you'll see there's a code there. And if you can pop in your country that you're from. So if you've got another device, you can use that, or you can also open another window on your computer, another browser, and put your country in. Right, so we can see from a number that we've got about 31 people that have been able to put in so far. We've got about 55 participants, but maybe not everyone's got access to Menti. So what we're seeing, the bigger the kind of word is, the more people are kind of coming in from those places. So I know as well, we've got people on the call from Tajikistan, from other places. If you've not got access to Menti, just please feel to use the chat and just put in where you're from in the chat. If you're struggling with Menti, and if anything is difficult for you with Menti, then just please use the chat. So we'll probably give it just a couple more seconds. And Paul, I don't know if you know, Campbell Paul, I don't know if you notice any countries that you've done work in or links with as you look at that list coming up.
Yes. Certainly. Colleagues worked within England, a little with colleagues from India. In fact, quite a few families from India who've migrated to Australia with strong links back home to Malta. Colleagues I've worked with in Switzerland, in Scotland, of course. colleagues from the Czech Republic, Netherlands.
Yeah.
But many countries where I'm really keen to hear more about work with infants and families. This is an amazing spread of countries around the world. Northern Ireland, yes. It's a home start in Craigavon. I don't know that I've pronounced that correctly in my Irish accent, which is absent. Moldova. We're privileged to make my first visit to Malta recently, which I really enjoyed very much. Okay.
Thank you. Well, we'll move on to the next slide.
Yeah.
And we're getting used to Menti now. So hopefully we can find out how everyone's feeling this morning. And again, if you're just on the chat, you can use an emoji in the chat and let us know how you're feeling.
Yeah, it looks like there's a good spread of feelings. Certainly some people anxious and worried maybe. A lot of people feeling happy, and sunglasses, I guess, is like.
Yeah, feel free, anyone, to use the chat for any questions, any queries. For those of you who've just come in, if you're able to, you can go to www.menti.com, and there they'll ask you for a code. And if you put that code in 15631975, and you can join in the voting through Menti. So yeah, so go to www.menti.com and put in the code. If you're struggling with Menti, just feel free to put reactions into the chat, add questions into the chat, and just welcome to everybody. It's lovely to have you with us. Okay, I think we'll move on to the next one just for time. Okay, so this one will come up, and it's about who do you work with, just to give us a little picture about who people work with in their different places. So if you can manage on Menti, great, but if not, just pop into the chat. Lovely. And Campbell, allow you just to reflect a little bit on the types of people that we're working with.
Yeah, it's a big spread. It's interesting to see how many people are working with both dads and mums, which is really important, I think. And with babies at the centre and older children. I guess children will include, well, what's a baby? I guess that varies depending on your setting and context and culture, but I guess we're often thinking babies sort of 0 to 1. Then we start talking about toddlers, and toddlers are children, babies are children, but a lot of programs will be working with babies, toddlers, preschoolers, 0 to 3, 4, and pregnancy as well. We haven't got a particular category for working with babies before birth, but I'm sure many people will be doing that as well. Now it's gone a bit blurry. That's great. That's again, I'm so pleased to see the inclusion of the whole family in your description of the work that you do. What do you think, Rachel?
Yeah, I think we'll move on, shall we? And we've got our first speaker who you can introduce, Campbell.
Yeah, so it's my real privilege to introduce Dr. Angus Macbeth, whom I've met on some Zoom meetings as a function of the Global Alliance for Maternal Mental Health, which Angus is very involved in, and we'll hear more about that as we go. But he's a senior lecturer in clinical psychology at the the University of Edinburgh in Scotland. I should say, when I was a young man, I spent 2 years at Royal Edinburgh Hospital and was very privileged to get an insight into mental health services in Scotland at that time. I learned a lot, and we're going to learn a lot from Angus as well. He's an honorary clinical psychologist, and in 2022 he was UNICEF Innocenti Senior Research Fellow. He's been focusing very much on the whole process of the first 1,000 days and how that informs development of services and understanding problems that are transmitted intergenerationally, and particular approaches to intervening. And he's worked across many countries: UK, Denmark, Malawi, Chile, Moldova, Tajikistan, as well as this long collaboration with Mellow Parenting. So I'll hand over to Angus, who's going to help us work out what frame are we working within. Thank you, Angus.
Comes up via Zoom in the end.
Yeah, I know. I've only just found the link.
Thank you, Campbell. And thank you to Mellow Parenting and Homestart for the invitation to speak to you from a dreich Edinburgh this morning. The rain is slowly coming down and it's grey, so it's lovely to be somewhere brighter online. So I think also I just want to acknowledge what Campbell was saying in the introduction about the sort of historical context. And one of the things that I'm becoming increasingly aware of is how important these sort of historical links to the land, to the people, and how identity shapes mental health. So you won't see anything directly about that today, but it's in the mix of what we have to consider. So my own sort of introduction to perinatal and infant mental health was actually through my clinical training and a placement with Mellow Parenting a little while ago now, and from there you'll see that fire my interest and my imagination. I also just want to quickly acknowledge a sort of privilege of, well, being able to speak to you, but also privilege as a white middle class Anglo-Saxon Scots male, and I think it's so important that we get past these legacies and into a genuinely global community and thinking about how we can learn from one another. So what I'm here to do, and just to acknowledge multiple other collaborators, I'm here to speak to you about some definitions about infant mental health, perinatal mental health, first 1,000 days, why these are important and what the benefits are. And I want to encourage us all to think big. So yeah, I've got about 18 minutes, probably less, to do that. So there's 3 parts to the talk. We're going to do some definitions, talk a little bit about risk and resilience, remind us of I suppose the impacts, and then we'll move into a little bit on interventions and programming. So in terms of definitions, I think within the broader context of the determinants of mental health, and when we start thinking about early years and even preconception, we are looking at the determinants of mental health going forward for the next generation. There's a number of big ticket sort of items, particularly from an implementation perspective: the social determinants of mental health, the structural determinants, the access to care, and increasingly commercial interests are part of this. But also the kind of political determinants of how health systems are organised. And mental health has historically been a bit of a poor relation within healthcare planning and health and social care planning. And one of the, I suppose, beauties but challenges of working in this particular area of mental health is the overlaps between mental health, child development, child health, and maternal health and family health. So you have a lot of leverage, but there's also a challenge because of that, the spread of that leverage. So moving forward, that gives us an additional element of the frame, just the importance of this family caregiver environment. And the WHO and a number of international bodies have been conscious of this for now several decades. And this quote from the Social Determinants of Health in 2007 just highlights the importance of the family environment because of the primary source of experience for a child in terms of the family members and that frequency of contact, and then that mediation with the broader social and community environment. So we know that those close to the child have a huge, enormous role to play, shaping hopefully resilience, but also unfortunately can shape risk. And more recently, UNICEF in the State of the World's Children 2021, which I wholeheartedly recommend you read, brings us forward, moves us into territories to the Bronfenbrenner ecological model and locates the child within these interlocking circles of the world around the world of the child, the family environment, the world around the child, and then the broader world at large. So we have these multiple frames to work from, and then we have to set our context in terms of our definitions, and that moves us into our evidence for what we do. So in terms of those determinants, I want to add an additional one, which is not on the big ticket, but Campbell's already alluded to this, that what we're working with is intergenerational determinants. The health, the situation, the circumstance of that parental generation then will also shape the offspring generation, and that's enormously exciting. So let's move forward to those key definitions. And I will use these interchangeably, and you will use these interchangeably. So when we talk about the territory that we're going to talk about today, we can look at that as perinatal mental health, which generally covers conception, but particularly from 0 to 12 months, sometimes later. It's a somewhat medical definition. We have maternal mental health, umbrella of I suppose, the health of the mother. We have paternal mental health also, although it's not on the slide. Infant mental health, where the focus is more on the infant, but has to include the caregiver unit. And as I say, intergenerational mental health. So those are 4 working definitions. I'm going to confuse things further by adding a 5th, and it's the one that I particularly like. And I think it gives us a conceptual model to work from, which we'll see in a moment. So UNICEF adopted this idea of the first 1,000 days, and the first 1,000 days covers from conception through to the second birthday of the child. And what that allows those of us who, like me, can't fix on one of those definitions, that allows us to jump between the focus pre-birth or post-birth, but also doesn't limit us when the child gets the first birthday. So we move through the sort of conception, antenatal, perinatal, postnatal, toddler phase. And that 1,000 days also gives us a lot of scope to maneuver. We can look at parents' risk factors, again, social, societal, environmental, biological. We can look at the child, the offspring risk factors, how these unfold over time, how these link to outcomes, and also how they link back on themselves. And again, when we think in this 1,000 days frame, it gives us a lot of scope to work in terms of outcomes. So as a clinician who trained originally in adult mental health, I always jump first to the mental health outcome. I see the pathology first, I suppose, the psychopathology. But also we have well-being, positive mental health outcomes. Access to education and the ability to thrive in education is an outcome. And additionally, as I said, particularly going forward, long-range outcomes, moving towards adolescence, we see the impact of identity-related concerns, peer relationships, who am I, what matters to me. So we have an enormous breadth of material to choose from in terms of our inputs for moving into the research language. Our inputs are factors that are important, and our outputs are outcomes, what we can do with those. And that takes us to a key pivot, and it pivots us into risk and also resilience. So I'm going to show you a few examples from my own group's work, actually starting with an example that isn't our work, but really brings home the interaction of these different factors. And these are risk factors for maternal mental health, particularly postnatal depression, and the risk factors in India. And the reason I'm showing you this slide is they are specific to India, but they're also in a lot of cases universal. So previous mental health history, the experience of domestic violence, finance worries, marital relational conflict, and then the ability to maintain or access support both from your close and wider community. These are the risk factors in India. These are risk factors in Tajikistan. These are risk factors in Australia, Scotland, Denmark. We could go on. So I think that gives us a frame. So much of this is social. So let's move on to some data. And this is data from a PhD student of mine, Francisca Morales, who's been working with a longitudinal data set in Chile. And my Scots-Chilean pronunciation makes that sound something like the Encuesta Longitudinal de Primera Infancia, or longitudinal study of infants. It's a large population cohort. And before I terrify people with the data, I just want to highlight where these are. These are the predictors of childhood behavioural problems at about age 4 or 5, and there's different groups. And what I want you to really take home here is some things cut across all groups. Being a male child is a risk factor. Children's language is a risk factor. But then maternal teen parenting, lack of social support are particular risk factors in the sort of higher, both high and then decreasing infant behaviour problems and child behaviour problems, and stably high problems. So we have different groups, and those different groups tell us that different things work for different people. I'm going to move slightly faster through my slides. So moving on from that, we can also see the impact of factors. Some of these are modifiable, predictable factors. Social support we can change. Education we can improve. Some things we can't change. So climate change, huge impacts going forward on health. We have data from the same cohort on the Chilean earthquake in 2012. And when you look at the impact of the earthquake, once you control, and the fancy diagram at the top here is basically just how we control for lots of other important exposures. Once we control for all these sort of social determinants of health, and we look at childhood behaviour, we can show statistically that being in utero during that earthquake is associated, once you correct for everything else, with higher childhood behavioural problems. Now that in some respects is quite scary, because we have a non-modifiable risk factor, but this takes us into our next pivot point around how we deal with interventions and planning. And I'm going to just take us into the Chilean context. And one of the points about the earthquake is actually the impact of the earthquake. The earthquake has happened, but there's a model within Chile at population level for access to childcare and early start, particularly infant focused. But that overall population model was then stratified based on risk factors, vulnerable children. So there is increased access to support for vulnerable children. Now, we generally think of that in terms of social determinants, but equally, the Chilean earthquake says to us that actually just that factor of time of being a child in utero during the earthquake may also be a classification for vulnerable child status. Then we can put the services into place, we can put the programming into place to correct for that early exposure. It gives us enormous scope. I'm going to move us through another couple of slides on interventions. I'll skip past that one because I'm just basically going to say that generally mental health funding goes to the usual suspects globally. Generally, a lot of funding goes towards high-income countries, but also sub-Saharan Africa. There are a number of areas of the world where mental health funding is limited or more limited, one of which is Central Asia, and that's where Mellow Parenting have been working, and we've been evaluating some of the outcome data from Tajikistan, and we've looked at that. We're preparing 2 papers from the Mellow Parenting intervention in Tajikistan and Moldova, but also comparing those with the UK implementation and evaluation data for Mellow Parenting. And what that shows us is when you deliver early intervention with an attachment of an interpersonal focus, you get immediate impact on maternal mental health, at least in terms of uncontrolled trials. You get big effect sizes for improvements in mental health, reductions in anxiety. You get improvements in parenting skills, and for those who can follow the colour coding, green is good, red is not so much of an effect yet, and blue is we haven't really looked at it yet. So maternal mental health improves, parenting skills improve, child behaviour improves, but it depends on the context, and remember there's so much there about what what's going in terms of the risk factors. Quality of life also can improve, but quality of life is one of these variables that isn't measured so much. But also what you can see is in areas where there is less access to care and systems, and less developed systems, particularly I'm thinking of Tajikistan, we get bigger impacts on all these outcomes when we deliver these early interventions. And if I just spend another minute on Tajikistan before I wrap up, we can see we've written a report with Mellow Parenting and Health Prom, and we have a map here of provision of mental health in Tajikistan, which is going to come up in a second. Here we go. And just to demonstrate here that the provision of the potential for support for parents and families is all across Tajikistan. I haven't sadly, due to COVID, been to Tajikistan, but I'm well versed that it's a country that has spectacular peaks and rurality, as well as the urban centres. But even in these rural settings, there is the potential for access to care. So rural would be particularly on the right-hand side of the map here. But even so, we can see that the systems are more developed in our urban settings. So that gives us a clue about how we can then programme. We need to continue enabling access in urban settings, but we also potentially need to enable access to early intervention in these more rural settings, and that may be through healthcare systems, it may be through social care systems, NGO work, and communities. In fact, communities are potentially key here. So I think, if I remember rightly, we're going to bring this all together with we'll move past that slide. I'll just speak to that in the next slide. Bringing this all together and summing up, we can look at a risk frame, and I'm always comfortable with a risk frame as a psychopathologist by background, but we can also measure these positive outcomes, well-being, resilience, the impacts both on parents but also the impacts on children, starting early but moving through to longer-term health, development, identity. But particularly when we get into intervention and implementation planning, it's only as good as what we measure. So if we don't measure the best variables, both in terms of baseline but also in terms of outcomes, we can't demonstrate that our interventions work. There are methodologies we can use around implementation. I'm happy to speak to people online or offline about what can be done, but we have to get better at measurement. And Mellow Parenting is a good example of how we've improved our outcome measurement for an intervention. Interventions for children start early. Even antenatally, I sometimes often argue, in fact, that postnatal is already potentially a little bit on the late side, but also there are gaps in our understanding. We don't understand lived experience well enough, particularly qualitatively as well as quantitatively. We don't understand the needs of fathers as well as we could. We don't understand change in society, and particularly these macro factors. I've talked about climate change, but equally the geopolitical situation across the world, particularly in the Ukraine as an example. We need to integrate these within our evaluation model, and we don't understand culture well enough. We know that Mellow Parenting works in Moldova and Tajikistan and the UK, but it works in different ways, and in other countries, of course. And part of that may be around culture. And from a research perspective, understanding and researching culture to then enable implementation is a tricky but worthwhile endeavour. We also need to get better at using data. We're particularly in early years, I would say one of the criticisms of the research literature is we've often used smaller data sets. There are opportunities to build larger data sets, to combine data sets, but for that to work, we need money. We need research money, but we also need the money for yourselves to deliver implementation on the ground and build evaluation into that. That's the only way we develop impact, and the various powers that be listen to impact, and that's what drives policy, and that's where we need to go. So I think that's probably enough for me. Think big. We can do lots. Happy to speak more right now and in future days and weeks to come. And thank you very much.
Thanks very much. Yes. That's a really powerful overview with lots of optimism and some really important key indicators of vulnerability for families and the importance of, I think you've emphasised the importance of measuring and being able to report what we do and the outcomes. So that we can continue to improve the services. If you'd like to ask some questions of Gus in the next couple of minutes, just pop them into the chat. I know B. Thompson has put in a question, and the question is about the vulnerability factor, which the trauma of those experiencing the earthquake. Is the vulnerability factor linked to the stress experienced by the mother? Presumably mothers or parents, people experience different levels of trauma. And they're also interested in how it transfers to the impact of COVID, which we're beginning to see now. Has COVID been a trauma? And how do we recognise and measure the impact of that, and what do we do about it in terms of support and approaching and influencing government practices? That's a lot of components to that question. But the first part was, can you measure, I think, the experience of individual people, and how much does that vary in the context of a trauma like the earthquake or COVID?
Yeah, so okay, I can speak a bit to that, and I think the measurement of this was really interesting because we recognised that there was a data set that covered this earthquake event, and I think that going forward, we know these climate change events will occur more frequently. Statistically, I suppose what we did that was relatively robust was correct for all the usual suspects, so all our kind of demographic and social factors, and then what that leaves is the event, which is the earthquake, and we also made sure that the geography only covered areas that the Chilean earthquake, although it covered a large part of the country, didn't cover the whole country. So it's only those earthquake affected children that we were measuring. But the mechanism, that's not my area of expertise. I suspect Vivek Glover's group would have far more to say, but the mechanism there is probably a neutral stress, which I suppose is a potential biological mechanism, but it's a biological mechanism, again, we can correct for. If we know there's potential stress sensitization, we can implement population level interventions to correct for that, and also stratification of risk. So experience of earthquake plus our other risk factors will increase your vulnerability. So it's different for, say, a teen parent compared to a parent, with high economic social status, with stable relationship. So there's more work to do there. I think the point about COVID is really interesting because I think COVID is much more of a differential experience and quite hard to unpick. It's going to take years to unpick from a research perspective, because for some parents, the experience of COVID and pregnancy during COVID will have been enormously stressful. Equally, for some, you have this opportunity for enhanced bonding, because both parents are at home, both parents have their sort of flexible working schedule. So yeah, COVID, different kettle of fish. But great question, thank you.
I guess the question also brings up what constitutes sort of resilience or strengths in the face of, as you've just mentioned with trauma, there would be external factors that might be part of that, but also what constitutes the internal strengths that individuals have who are, even in the context of other major psychosocial stressors, able to bounce through traumas like an earthquake or other similar traumas. And I think it'll be interesting to see how the further evaluation of Mellow Parenting and Home Start shows us how the workers on the ground can identify the strengths in families. So I wonder if that's part of the question that V. Thompson was taking us to. Yeah.
Absolutely. I think measuring the it's easy in some respects to measure depression, negative outcomes. It's much harder to measure these positive outcomes and resilience, particularly on the ground. But yeah, absolutely, we have to do it. We have to figure out how to do that.
It's interesting, the qualitative paper coming out of Mellow Parenting just this year, I guess, addresses some of that from the narratives that the research group drew from the individual families about the importance of the role of mellow parenting. I suspect that people spoke to some of their own strengths and the strengths in the parent support agency relationship in that. Well, that's wonderful. I wonder if we might move on now to our next presentation with Kirpal Dada from Home Start Worldwide, and Kirpal is the CEO, and we'll be joined by Lizzie Poulton, who's the Network Development Lead for Home Start Worldwide. I know Home Start is very active in Australia, but the worldwide name is really important, and I hope to hear a bit more about that in this presentation, as Kirpal and Lizzie are going to be describing the landscape within which this jigsaw sits. So Kirpal and Lizzie, thank you very much, and I'll hand over to you.
Thank you, Campbell. Can I just add that it's an absolute pleasure to be part of this conference and to see so many people involved in it. Amazing to have such a turnout from all over the world. So thank you to everyone, to Campbell. And it was fantastic listening to Angus. It really made sense, everything that you were talking about in mental health. It's so relevant to the work that we do at Home Start, as well as the work, obviously, that Mellow Parenting do. So I'd like to start off by just introducing Home Start and Home Start Worldwide to many of the participants who are not aware of what we do around the world and what this model is about. So Home Start Worldwide is a UK registered charity. And our aim is to see the world where vulnerable families receive the help that they need to give children a safe, healthy, and happy start in life. And our support is based on a simple formula, and that is about recruiting, training local volunteers to support families who are facing difficulties, to help ensure that the children get a positive early childhood. And the way our model works, it's about the regularity. It's involving volunteers offering regular weekly home visits based on firm friendship, mental support, who by volunteers who are parents themselves. Next slide, please. Next slide, please. And in terms of our partners around the world, Home Starts, we are in 20, where all partners are independent Home Starts. But globally, our footprint together is 20,000 volunteers that support, or in 2021 supported 37,000 families with 73,000 children. And that is quite something when you think about data sets that Angus was talking about, that if we can collect that data and if we can show our impact, there is something really meaningful there that we can start working on. Next slide, please. And in terms of where we are in the world, Campbell mentioned a very big contingent in Australia. We are on all 5 continents. We have a lot of countries involved in Europe, but in Africa there are 5 Home Starts. So, we cover a huge area, but we want to continue that. We want to support more families around the world, and we want to be developing greater partnerships with other countries and other organizations. So how does Home Start as a model support mental health? And it is on 3 levels. Next slide, please. Our focus is very much about supporting the parents, supporting the family to be able to support the children and connecting them to the community. And what we would like to do in this presentation is really give you some examples of what our support looks like in supporting perinatal infant mental health around the world. Because this model is so simple. It is about a volunteer offering non-judgment to a family, helping them through that difficult period that they're experiencing. So how do we do this? How does it differ around the world? Culturally diverse. It is a model that is very bespoke, yet there is huge consistency in our support. It is culturally sitting within the context of that community. So I'm going to hand over to Lizzie, who's going to share some examples around the world that we have been working with as Home Starts. So over to you, Lizzie.
Thank you. I think this quote from Australia just really sums up what was on the previous slide around how our support can work. So if we're supporting parents, we're that isolation, parents facing stress, having someone to talk to, all of those risk factors that Angus was talking about, helping mitigate those with, reduce isolation, and then directly helping the children. So making sure children have the interaction, the serve and return, all the things that they need from their caregivers to grow their brain and promote their positive infant mental health. And then also connecting to communities, which again was the risk factors that Angus identified. And I just love this as an example. So this is obviously a mother who was really struggling with her children. She didn't feel she could enjoy them. She was angry, she was resentful, she was tired. But actually watching someone new coming into her life to support her, helping her connect with her babies, helping model the play, using her own resources, all of that makes a huge difference. And it's that really small things, it's someone coming in, playing with the child, helping the mother see how to do that can make such a massive difference. So that's the kind of a quote that shows how it can work to support the mental health of both the mother's mental health and also that infant mental health and development side of things. We do have some academic research as well, which is from the Netherlands. So the focus on that, there was a 10-year study comparing Home Start to a control group, and it didn't specifically talk about mental health and what have you, but it did talk about parental well-being, parental competence, parental behaviour, and also then the behaviour of the children. So how connected they were, what that meant in the longer term. And that was continued for 10 years post follow-up. So improvements in maternal feelings of competence 10 years later. Parental behaviour was still improved 10 years later, and child behaviour was sustained or improved 10 years later. So that simple thing of a volunteer coming in, finding out what's going on in your life, what you're facing, what support they can give, really makes a difference to parents and children's outcomes. And I'm just going to show you a bit about what that looks like in practice. So I've got some examples from different countries around the world. So the basic model of matching a family or with a volunteer is the same, but then different countries have also put more of a specific focus on this perinatal period, on this first 1,000 days. And so this is what's happening in Belgium. So they've developed the close relationships with hospitals, midwives, family nurses who can all refer into the programme. So it's having that network. They're doing additional training for volunteers, specifically around perinatal support for families in vulnerable situations. And they're tying in with these networks of partners to where they can coordinate and share expertise, and Home Start can be a really valuable part of that network. And what they found, actually, this next slide is what that support can look like. So it can be incredibly varied. It's based on the needs of the family. And I think this is a really good summary of particularly what Belgium are doing, but also what a lot of Home Start volunteers all over the world are doing. So, it's going to the medical appointments with people. It's helping them source the baby equipment that they need, because we know that poverty is a risk factor as well. Support helping childcare, that development stimulation, reassuring parents. I just think is such an underrated but vitally important thing, actually, if you're isolated, to know that you're doing a good job. So that's quite a good breakdown of what that support can include. And then interestingly, what they've learned from that is they prefer to start in pregnancy. So actually what they've realised is that if they start supporting the mother during pregnancy, often that support is very effective, and after a year that support can end and they feel like the parent's in a good place. But sometimes if it's after birth, quite a long time after birth, actually it takes longer to get the family to a point where they don't need that support. And a second point from Belgium, which is really good, is it's not just about the firstborns. Actually, the birth of the second child or the third child can still be a very difficult time, and people still need that support then. So that's what's happening in Belgium. In the Netherlands, again, they've got this government focus on the first 1,000 days and these networks of Promising Start coalitions. And the brilliant news is in the Netherlands, our Home Start, Gerda, who's on the call today, is part of the National Working Group on Promising Start. So Home Start is right there in that government coalition. And so as part of that, they offer additional training of volunteers again, and they also are specifically working to engage pregnant women to make sure they're getting people that need support at the earliest possible opportunities. Japan also has a focus on perinatal, and again, they offer specific extra training for their volunteers. And I wanted to include this as this is the focus in Japan, what they do for their training around volunteers, and including about birth, mental health, the support systems, making sure the volunteers who are supporting mothers and families know everything around the mother, what's available, how they can help, and then also that role play and group discussion, and making sure they're really prepared for supporting those families. In the UK, they also do additional training for volunteers. So the UK is the biggest Home Start. It has over 180 independent Home Starts in all different areas of the country. So a lot of those Home Starts are doing lots of great projects with perinatal mental health, and Home Start UK is trying to bring all that together. And so their training focuses a little bit more on the infant side of things, that relationship side, helping volunteers to support the serve and return, the stimulation for babies' brains, and support parents to do that. So they've got training, and then the other thing they're trying to do across their network is that development. So if we move on to the next one, it's that connection. So as I said, they've got over 180 Home Starts, but they've got a perinatal mental health champion in each of them that they're trying to bring together and make sure the whole network's understanding. and ways of working can improve, and then also running masterclasses on different aspects and different elements to make sure that everyone is upskilled and up to date and supporting the best way. And again, just a quote to show the impact of that, the power that a trained volunteer coming, listening, helping, showing you that you're doing a good job. They can now, they want to leave the house. They feel like they're doing a good job for their children, and then they're giving their children all those extra opportunities as well. So moving on then to our home starts in Africa, again, there is a big focus on that first 1,000 days and also pregnancy. So the Home Start model is adaptable to different environments, and the challenges in sub-Saharan Africa are obviously different to the challenges in Europe or Japan. And the focus there is more around kind of food insecurity. But as part of that, food and supporting pregnancy, supporting young infants, making sure they've got the education, making sure they've got respite food, and actually where in some countries they might be referring to a food bank or they might be helping find baby equipment. In Uganda, the volunteers help with seeds and fertilizer so that families can grow some of their own food to make sure they've got better nutrition for their families, which again is building that brain for the baby, making sure they've got all that development stuff. The potential is there. It's not being stunted by lack of nutrition, but also it's supporting that psychosocial support, they call it in Uganda. So again, it's the connection, it's the talking to people, it's the being involved in your community. All of those elements that a Home Start volunteer would be doing anywhere else is happening in Uganda, with more of a focus on the kind of practical nutrition side. And again, just quickly, Burundi is similar. So again, family planning, women's health, teenage mothers, maternal infant mortality. But as an underpinning of all of that, it's the basic model of volunteers offering support, offering connection, offering families access to those structures that can support with health and mental health. And Zambia is soon going to be launching a program again with the nutrition element and the social support alongside it. So that's a flavour of the kind of the different things happening across the network. If you want to find out more, the website is at the bottom here, and that's our contact details as well. And obviously, we'd love to answer any questions. And we've got lucky to have people from Home Start all over the world on the call as well. So hopefully in your breakout rooms, you'll be able to see them too.
Thanks so much, Lizzie and Kirpal. That was really very helpful and an amazing worldwide network that's been built up over a relatively short time. Although Home Start's been going since what did I see?
50 years this year is the
50 years. Yeah, that's pretty amazing in itself, isn't it? That's to have had an organisation that's been working with volunteers and depending on volunteers sustain itself in so many countries over such a long period of time and being so effective. That's amazing. There's a couple of comments here. Rachel was saying how she was struck by the process of poverty alleviation and income generation as a way of supporting families and supporting families through pregnancy as well.
And I think that's so similar in different countries. It looks very different in the UK to what it looks like in Uganda. But the underlying thing is, that stress of poverty and that stress of not being able to look after your children the way you want has a massive impact. And how we can alleviate that.
I was struck by what you were saying and what I was reading in some of the quotations from families on the website, how the volunteers are right in there amongst the intensity of family life. They're hearing stories from the families that they're working with of significant mental health distress and problems. And I wonder how they manage that and what systems have you got to support the volunteers when they're working with someone who's really distressed and maybe talking about profound depression, even suicidal ideation. I know some of the quotes in the online website discuss that. What helps the volunteers get through that?
Answer that, Carpal, or shall I?
Do you want to answer it, Lizzie? It's
Sure.
first-hand experience of working.
Yeah, so I think it's a mix of things. Obviously, the quotes on the website are probably from the more dramatic stories, and a lot of the day-to-day work is that kind of prevention, support, helping people not to get to that point. There is also, I think, the professional coordinator is vital as part of our network. It's not just having volunteers. So the coordinator will meet with the family first. They'll understand what the situation is. They'll be able to brief the volunteer appropriately. And they have monthly or 6-weekly supervision with their coordinator. So if they're worried about anything, it's not on the volunteer to do that. The volunteer is there to support and help as much as they can, but they're not responsible. And that's definitely, we have quite an intensive training program for our volunteers as well.
Yeah.
And there's lots around boundaries and lots around, the role of the volunteer. Because there's so much that friendly listening ear can do. But obviously they're not mental health professionals. That's not the role. And it's about making sure that they've got a professional coordinator to call on, and that professional coordinator is connected with all of what's going on in their local area as well, to be that network. And I think that's what the Netherlands and Belgium do really, really well, is that they're connected right in with that network of what support's available for families. And they can refer on, but still have that contact of, someone friendly who can help you fold the washing when your children have been screaming and you've not been able to look after your house. So that's.
It's interesting coming from the perspective of an infant family psychiatrist. I imagine that when you've got that trust built up, you'll find parents will share things and babies and toddlers will share things with the volunteer too. There'll be significant relationships built up between the baby, the toddler and the volunteer, but they might share things with the volunteer that they won't tell the professionals. So it's a very privileged position, and it sounds like you've got an amazing set of supports for the volunteers to safely and effectively do their work. A few comments. Someone was asking, Sharon was asking what the cutoff age is for children that can be referred to the Home Start programs.
That depends on the country and the way they're set up. So if you've got a Home Start in your area, they'll have, generally it's preschool. That's the main focus, but some programs do have programs for school-age children, Home Start Plus. So it would be looking locally as to what the criteria is for you. Yeah.
And Michelle McDonald from Australia was saying how I think she's saying for the volunteers themselves, their own sense of achievement and mental health is improved because they have a purpose. They're giving back to the community. And I guess you'll have seen that around the world too. Someone else Benjamin was asking, do they volunteer need academic requirements?
No.
Or particular
we ask that they have experience of looking after children. So that's the main thing. It's that kind of experts by experience. They understand how tricky it is and how tricky it can be to raise small children. And the skills, again, it's not academic skills. It's, listening, empathy, non-judgmental, all of those sorts of things, the qualities we look for in volunteers.
Brilliant. Well, I'd encourage people to look at your website, and we'll have an opportunity in the small groups, though, to like to introduce Rachel Tash, who you've met already in many ways. Rachel is an amazing person with a background in physiotherapy and community disability studies from University College London, and her talents and skills have expanded way beyond that into this amazing organisation that's Mellow Parenting. I was privileged to have a visit at
at Glasgow and Eastland about a decade ago, and met some of the families and sat in on some of the group work. It's an amazing model and project, Mellow Parenting. Rachel started with Mellow Parenting in 2015, and she's had a role as international and program lead, designed lots of program and delivering offline Mellow Parenting training and supervision as well. So I'm going to hand over to Rachel, who'll talk to us about this process of getting a puzzle solved. What's the view now? What's the view from here? Particularly through the Mellow Parenting lens. So over to Rachel. Thank you so much.
Thank you very much, Campbell. It's just lovely to be with everybody. So many friends from across the world are here from different places that I've visited and worked in. So just say hello to everybody and thank you for joining us. We'll just go on to our first slide, just thinking about Mellow Parenting and the kind of our reach really and what we do. So on the left-hand side, we've got a tree, which is some of the things that we hope that families and parents who attend our groups will experience being part of our group. So having choice, finding hope, having a non-judgmental space. We've already talked about some of these things today. And then some of the countries that we've worked in and had evaluations there. And I'll let you figure out which flag is which, but just a little bit of a flavour of some of the places that we work. And we'll move on. And this next slide, we've been thinking already, haven't we, about being rooted to the land and the culture of the land, and how sometimes people have been displaced and awful things have happened to people who have indigenous to the land. We've already thought about those kind of things and this respect for being rooted in place. And I'm going to be specifically focusing on 5 places where Mellow works today, 5 countries. So thinking about New Zealand, Moldova, Tajikistan, North Macedonia, and Turkey. And I've also got a little photo of Scotland here. So just for a second, I'll let you just have a think which country might be which in these landscapes, but just thinking that we all come from different landscapes, from different backgrounds. We all have different things that are influencing us in terms of our own families and the perspective that we have. And it's been a real privilege for me to travel to some of these places and see things from other people's perspective. And I've learned a lot from doing that. So we'll go on to our first slide. And I was thinking, as well as maybe commonalities and landscape, there's commonalities as well in some of the experiences that people have had. Angus was telling us to look at the big picture, to see the world context of what's going on for children and families. And here are some of the things, some of the challenges, some of the important cultural differences or cultural values that people have, or different things that maybe countries have experienced, populations have experienced, maybe groups within countries have experienced, that maybe make having a family life and supporting children and families and pregnancy maybe more difficult, maybe more challenging. And so we can see things like poverty, disability, urbanization, autocratic governments, patriarchy, displacement. The actual terrain itself can make it difficult for people to access services. Spirituality and faith can be so important for people, but that can also lead to conflict. So there's lots of things that are involved in influencing families. And what we're going to have a look at is a series of videos from these 5 different places where Mellow Parenting practitioners are going to be sharing the stories of how they use Mellow. And I've tried to bring in different aspects from different countries as we go through. So let's move on now. So one of the things that we've been looking at in the UK recently is there's been a big independent survey, a family review by the English Children's Commissioner, a lady called Rachel D'Souza, and she's been asking children what's important to them. And this is what one boy told her: a loving family is worth more than money and will give you guidance and love and advice. And families come in all different shapes and sizes. We know that, don't we? But valued by children in terms of the love, the support, the advice, and it's much more than money. So let's move on to the next one. So we're going to hear now from Irina in Moldova, and Irina's going to share about the importance of family. So she's going to talk about a Mellow group that happened in a region of Moldova, which is a kind of Bulgarian speaking region and Russian speaking region in Moldova. And she's specifically going to focus on the impacts on the children, what the children got out of being part of the Mellow group. So thanks very much, Irina, and we'll look forward to listening to this video now.
The impact the children had by attending the Mellow group. Mellow Toddlers program in Taraklia district engaged with 6 mothers and their 6 children, their age range ranging from 18 months to 2 years and 7 months old at the beginning of the group. The most important thing, in the opinion of the facilitators and moms who benefited, children got the opportunity to communicate more with their parents. Also, this has been a way to gain their first social experience, learn how to interact with other people, understanding the child needs. Child needs to be in a circle of close people to feel their affection and support. The mothers have learned to listen to and hear their children, to get away from the stereotype: the child is small, he or she does not understand much. Thanks to this, the children began to be less moody and manifest less challenging behavior. Here are a couple of quotes that I would like to share. I learned to be more tolerant to the pranks of the child, as I call it, because this is how my child explores the world. And my son began to throw less tantrums. For example, when I went for a walk, I allowed my child to run through the puddles for the first time. And I enjoyed his emotions, and the child was very happy. This was the most important thing. And all this thanks to the knowledge I gained during the program. Overall, the program has created a small community for these moms and their children, where they could share their joy and worries, challenges and fears, and realize that they are not alone with this or that problem. And most importantly, they realized that they could get support from each other.
So thanks, Irina, for sharing that. We see this child being part of a close circle, of being listened to and understood, of being able and being allowed to jump in puddles and explore the world and take risks. So all of these things that the children gained from being part of the group, and maybe you'll have picked up others that you can share as we go on. So if we go on to our next slide, in Scotland, we've been thinking a lot about what nurturing care looks like, and thinking about our offer, or what we need to do, what we need to provide for families. And we had a big independent care review recently. And as a result of that, the Scottish Government made a promise to families. And the promise included that where children are safe in their families and feel loved, they must stay. And families must be given support together to nurture that love and to overcome the difficulties which get in the way. We talked earlier, didn't we, about the buffers that families need, that support that they need to be able to nurture their children, to enable them to feel loved and to enable them to feel safe. And this is one of the things that we're thinking about quite a lot in Scotland. What does it look like to get it right for every child and for every family? We move on to the next slide. But we know, don't we, as well, that a number of children around the world experience violence in their family situations. And that can have a very, very detrimental effect on them. It can impact their ability to, and their trust in adults to keep them safe, their ability to actually access and use educational opportunities, their social and emotional development, the quality of close relationships that they make, and their capacity for emotional and self-control, their ability to have fun, to play, to explore, and of course their self-esteem, their self-understanding, and their confidence. So a big impact. And we're going to, our next video is from Tajikistan, from my good friend Umeda, who's going to be sharing about the wider impact. So there's lots of practitioners, Mellow practitioners in Tajikistan. They're involved in delivering Mellow, but the skills that they've used in Mellow are also helping them to be part of wider initiatives around violence and keeping families safe. And Umeda's going to talk now about the experience of working with families with experiencing domestic violence and the impact of that. Women aged 18 to 24 were the most likely to experience various forms of violence in Tajikistan. And of course, that is the key age for motherhood in Tajikistan. So most of these women who are experiencing violence will have children, they will be pregnant, and we know how quite often violence and interpersonal violence that comes for the first time in pregnancy. So we're going to hear from Umeda how the team and the wider network that she's part of is involved in supporting families who've experienced violence. Thank you.
Last year, we were working with 50 children and from 22 families where there was an experience of domestic violence, especially violence against children and mothers. So we provided legal and social assistance to these families in order to protect mothers and children. We conducted trainings for mothers where they learned about positive parenting skills. They learn about their rights, how they can protect themselves and their children from the violence. We work with the families, just giving the consultation or advices is not enough. Because usually they have complicated needs, or the reason why they're in difficult life situation, it is economical situation in the family. And so that's why they really need some financial support to overcome difficult life situation. For example, some ladies that we supported last year, they even didn't study at school. And she, for example, mother can't write her name, and she cannot help her children to make their homework. And she has no any professional skills. So how, in order to make her to improve her self-esteem or to help her to become more independent, we have to provide her some financial support as well. For example, last year we helped one lady, mothers who hadn't any professional skills, to run micro business like in her yard. So then for this money, the money that she earns, she could buy bread for her children. Tajikistan, mothers are most vulnerable, and we have to help them financially to help them to overcome difficult life situation.
So thanks very much, Umeda. I don't know what you picked up from that video, but it's complicated. It's difficult. We need to think about the economic challenges. We need to think about micro business, this wider context of working with families. Thank you very much, Umeda, for sharing that with us. So let's go on to our next slide. And again, I've been thinking a little bit and exploring this report that came out recently. This is related to the UK, and it's from the Centre for Social Justice in the UK, and they really work to tackle poverty, and they try and think about the challenges for people who are experiencing multiple disadvantages and injustice. And one of the things that they talk about is the importance of trusting relationships in supporting those who are vulnerable and disadvantaged. And what they've, in their research in the UK, they found out that when that sense of community declines, when there's a lack of community, a lack of people feeling a sense of belonging, there's an increase in loneliness, insecurity, feeling left behind, poor mental health and poor physical health. And that makes it much harder for families to flourish, for children to flourish. And I think we've seen that in some of the situations that we've been talking about today, and how early intervention, how supporting families can make a difference. Let's go on to our next slide. And we're going to be thinking now, we're going to go to Turkey. And one of the challenges in the COVID pandemic was, how do we reach out to families? How do we get to people in rural areas, in areas where they maybe don't have access to groups? And the team in Turkey, Tolga and Figen, and the practitioners there worked really hard through online groups to reach out to those families who were feeling lonely and isolated and vulnerable, who were feeling that they didn't have a community around them. So we're going to hear now from Tolga and Figen sharing a little bit about the experience of online groups, particularly for pregnant women in Turkey. So I'll let you hear them now.
From January to May 2021, we delivered online Mellow Moms groups and reached a total of 128 pregnant women. The results of routine evaluation data proved that the training was successful in improving mental health symptoms and mental well-being of the experts. They could share how they feel with other people, and they did not feel alone in such a lockdown period.
We had seen some advantages of the online format. It makes the program more accessible, reaching wider audiences. There were participants from 21 provinces in Turkey, and it included rural areas as well. It would not be possible to reach mothers from so many different cities with face-to-face trainings. So we saw that online space provides many advantages in terms of accessibility, comfort, saving time, and there was less expense. So one mother said, even though we couldn't be face-to-face, I felt your warmth and sincerity with all my heart. And another one says, I feel that I have sisters with whom I can share my experience after my baby will be born.
My baby is 6 months old, and we will still a team that I can share my feelings with.
Mm-hmm. Another mother, before I start this training, I had concerns about being online. However, it was a unique, friendly atmosphere, and it was incredibly good to meet other expectant mothers. Friday was the best time I had for myself. Sometimes the hormones peaked, we cried, sometimes we laughed immediately, and then the 8-week education was over. This must be what they mean to spend quality time with the friends. I would recommend it to everybody, and I would like to thank everyone who contributed to the whole process.
I love that quote. This is what it means to spend quality time with friends, building trusting relationships, experiencing that sense of community, even online, which is what the Turkey team was able to achieve through those bumps groups, and reaching out to those rural areas that would be really challenging to reach out to otherwise. If we go on to our next slide, again, the report that I was talking about earlier gives a real clear message about what is needed to build community. And if we look at the bottom of the triangle there, that sense of security. And that sense of security actually also includes a stable family, having those relationships within your family, the human connections, and a feeling of belonging. So these are the things that help people feel part of something bigger than themselves, feel part of community. And one of the things that we find is that often parents feel a stigma about getting support or being part of a group or accessing help with parenting. And one of the things in that report that we had from the UK government was that actually we need to get over that stigma, that we all need support as parents, and that we should feel able to talk about parenting and be able to attend parenting courses. So we're going to hear now from New Zealand, and we're going to hear from a mum who attended a Mellow Ability group in New Zealand. So Mellow Ability is our programme for families who have children with additional needs and disability. And you're going to hear about the particular impact for her family of attending this group. Thanks.
Really useful and helpful, and it's actually brought me closer to my daughter. Communication was another one, because one of the exercises you had to try and guess what someone was saying, but without them talking, and that was really emotional because my daughter is nonverbal and she goes through the same thing. So that really made me deeply think about what she goes through. It is very deep, and I know some people will probably think, you know, why do we have to talk about our past? Sometimes it's a good thing because we could be frustrated at our kids because they could be doing something that, you know, that's normal to them, but really we're holding on to a lot of stuff from the past. I was one, and Afterlife Stories, I actually released a lot that week, and I've been good ever since. Facilitators were amazing, very supportive. They don't judge, they don't pressure you. You know, they're very relaxed when you walk into the room. You can just feel all the love, and yeah. It's brought me a bit closer to Panya, but not just me, also her dad. He had a real trouble trying to understand why she would do the things she would do, or, you know, it would frustrate him. Me and him would fight because we didn't agree on our parenting ways. We had different parenting ways, but after Mellow Ability, I'll take everything from each session, take it back to him. And he tried every week using everything I'll give him, and now him and Panya are closer than ever. And he is amazing with her, and he's more understanding, and I couldn't say thank you enough to Mellow Ability for that.
So a great experience of being part of a Mellow Ability group that helped this mum's relationship with her child, but also with her partner, with the whole family, being able to get that mutual understanding, being able to communicate, and being happier together as a family. So that's a fantastic outcome of this group. So Campbell referred to this paper earlier, There's More Love Between Us. It's one of the recent papers that's come out from some qualitative research that we've done. And thinking about actually what makes the difference, what are the drivers of positive change when participants come in to a Mellow group. And we can see the things that they value, that sense of being part of a community, cultivating a new community, space to make sense of the difficulties. And that's what that mum was talking about, wasn't it? Space to process what happened to me in my past. And actually, some of the things that my daughter is doing is triggering stuff that happened to me in my childhood. And I need to deal with that in order to have a new relationship with my daughter. So that's space to make sense of what's been going on. And we think about intergenerational transmission of trauma and being able to make a change in that. And this opportunity to reshape interpersonal reactions. And I think we very much saw that in that explanation that mum gave there. So we're going to come on to our final video now, and this is for Sina from North Macedonia. And in Mellow Parenting, we use a lot of video feedback, video work, and actually we see that video feedback can be great in terms of thinking about interpersonal interactions and reshaping them. And Francina's going to share her experience of using video feedback and what she's learned from it.
We ask from the mothers, from the parents, to record a couple of minutes short video of their everyday regular activity with the child where they take care of them. It may be feeding, it may be changing clothes or something like this. And we ask that we can see the face of the mother, the face of the child, so we can follow their interaction. And afterwards, we have a first individual, we look at the video together with the parent individually, and afterwards we look at within the group. But the most important is the individual first, because first, many parents are surprised when we ask from the video, and secondly, they don't know what we're gonna do with this material. But in the end, we try to focus as much as possible on their strengths. And even though it's really every day, maybe sometimes seen as boring activity, a lot can be seen. And we see that much of the content comes from the mother. It's not us initiating, discussing, advising, but it's them. And what this activity can motivate them to speak about their everyday life and their relationship with it. It was the thing that I was most anxious about before starting the Mellow group. And I was, when I asked the parents to record it, I was not really maybe sure before the first cycle we got it. But since we started the individual interviews, my resistance just started melting down, because I saw how they got relieved, how they got relaxed, because all of them said that they were expecting that some kind of expert will be telling them where they do wrong, how should they do the parenting. Instead, we had a discussion that was from small details to their big emotions, expectations, and worries in their relationship with the child. And I think that it helped a lot of building trust in us as a facilitators in the beginning. And then it helped, I think, build the trust within the group, and it sped up the group cohesion when we started to video feedback with the group setting, because it is an intimate moment. So I think it was really important that we didn't force they get close, but just by seeing how they the love and the tenderness and the care they share for their children. Also, they shared a lot of difficulties. Some become very vulnerable. I think it strengthened the sense of community and connectedness between the mothers. And third, I became a parent shortly after we finished the first group. So I really I make like maybe one video a day in my head while doing these activities. And it helps me really stay present and follow the baby's response of the way I do these regular activities, let's say. And I see that they take and make big part of parenting instead of some big ideas maybe I had before becoming a parent.
Thank you so much, Francina. Francina has just become a new mum in the last year and learning a lot. And I really appreciate what she shared there. Just going on to our last slide. So we've hopefully gone on a little bit of a journey around different places where Mellow Parenting's been used around the world. And I think we've seen some common themes about the importance of family relationships, social support, structures, how people want community, they want to feel part of something, and this idea of security, connection and belonging, and the things that enable that, which are around choice, around access having that facility, that access to being able to connect with others, and stability to be able to do that. So thinking to be able to help people on their pathway to participating and to strengthening communities. So thanks very much. Thank you so much to all the people who allowed me to make the videos or made the videos for me, and speaking in English, often second or third language. I really, really appreciate that. Thank you.
Thanks so much, Rachel. That was an amazing journey through so many different countries, and how Mellow Parenting is adapted to different circumstances, families where the child has some difference of ability and anxieties around that, and how the work of the group can be so powerful. There's a couple of questions. One person asked about in Tajikistan, workers were supporting families outside a Mellow Parenting group and are able to use skills from their training. What skills do they get that will help the workers to do this?
Yeah, I think one of the things that we've realised in Mellow, that actually by going through a Mellow training, it's not just about the skills that you get to deliver a group. It's about building your own capacity, and we very much see about this whole developing the workforce. So even just what Francina was talking there about, that video skill, that feedback, being able to notice, being able to name, being able to pick up cues and support parents to pick up cues. So that's really helpful, whether you're doing video work or not. You can use those skills in other settings. That whole ability of how to facilitate a group and how to draw people out, how to work as a team, all of these things you can use in different settings and not just within a Mellow group. And this openness, this wanting to remove barriers to get people access to the support they need, that's a big value that we have in Mellow.
Yeah, exactly. I remember many years ago we had a psychotherapy group for babies and mothers. Sometimes a father came as well. What we were especially interested in was what happened between the infants within the group, the infant interactions, and how the parents watched that as well. They learnt from what their babies were doing and their toddlers were doing when they were interacting. And what gave us deeper insight into that, I think, was the use of video, being able to look back on, as professionals, but as parents too, look back on the micro of the interactions, and how things change. That was an amazing story from Turkey as well. Rika Hedges from Hungary was asking. Was asking, do you train local professionals for organising, running the parenting group? How do you disseminate the skills?
Yeah, we normally work with partners in different countries. So, for example, in Moldova, we've worked with Partnership for Every Child, who are a big organisation working there in social protection, and working with children and families. So we've worked, and they've worked with different local authorities and with the government and with UNICEF. So we've brought people in, who are maybe already working in this area. So they could be government employees, maybe working in social work, or NGO employees, and we, quite often we'll have kind of groups where, people from government structures will be working with NGO structures. In Tajikistan, we've got a network of NGOs that we're working with public organisations, supporting them. Also with UNICEF, we've got a very big partnership in North Macedonia with UNICEF. And again, they've identified key people who are working with children and families. So we tend to come alongside local organisations who are already doing that work and upskill and train them. Yeah.
I can imagine you'll have a few administrative things to manage with coming into another country and supporting and working with others. And there's probably a few stories you've got there to do, maybe for another time. Just how do you get through, and the trust of the bureaucracies as well as the individuals.
Yeah. And there's a lot that we know in Mellow. It's not about just building trust with families. It's about building relationships and trust with our partners, with the people that we work with government officials, actually saying, we've got something and we can work together on this. And that's just as important as the actual running the group. So we think about every relationship mattering in Mellow Parenting.
Hello, everybody. My name's Alan Gregoire. I've been a perinatal, that is mother and baby psychiatrist for the last 25 to 30 years in the UK. And it's a huge pleasure to have been asked to speak to you briefly today. I'm really, really sorry that I can't be with you at this really special meeting of truly fantastic people that you are. So I apologize for that, but I hope this recording of my talk that I've made for you is of some interest. So I've been asked to speak a little bit about the Global Alliance for Maternal Mental Health, and I've given this the title of people like you and organizations like Homestart and Mellow Parenting working together for better maternal and especially perinatal mental health. And by perinatal, I mean during pregnancy and for the first year or two after giving birth. So just a few facts to start with. Worldwide, and by worldwide I mean all of 196 countries, there are about 131 million births every year, and that means that about 131,000 women are suffering with the most severe illnesses that we come across in the whole of mental health. That is postpartum psychosis, and of course, hugely greater numbers suffering from the slightly less dangerous illnesses, but nevertheless illnesses that cause extreme suffering. And for example, right now, as I'm speaking to you, about 13 million women worldwide at this moment are suffering with what we call depression, pretty widely understood mental health problem. And it's really important for us all to remember that 90% of these women who are suffering are in low and middle income countries, not in the high income countries that have the means to try to do something about mental health, although most even high income countries spend far too little on mental health care. And low and middle income countries have obviously proportionately much less resource for healthcare generally, and mental health care in particular. And of course, we don't even have the figures for the numbers of women who are suffering from post-traumatic stress disorder, and that really pernicious form of post-traumatic stress disorder, which we know as complex PTSD, which largely arises from traumas and adverse experiences that people have suffered in their early childhoods. And the earlier in our lives that we experience adversity and trauma, including the things that parents who have mental health problems can't protect us from when we're very, very young, the greater the effects on us. So traumas in adult life can cause major mental health problems, but traumas in early life can cause lifelong disabling mental health problems. And that's most of what we see in mental health difficulties and mental health care throughout the world. And of course, those numbers are growing for reasons that are pretty clear from some of the images and figures on the screen. Now, when it comes to trying to do something about mental health problems worldwide, a starting point for governments and for nations and for societies is to have some notion of what they're going to try to do. So just putting down on paper, or indeed electronically these days, some plan for action, some sort of policy, some sort of vision of making things better for the lives of the population is necessary. You can't put huge amount of efforts if you've no idea where it is you're heading. And even at this most basic level, both rich and poor countries are failing their populations appallingly. Most do not have strategies and policies for perinatal mental health care, although, as you can see from this map in green, there are rich and poor countries that have managed to have such policies. So that doesn't necessarily mean they're taking all the action they need to, but at least they've stated what they're trying to do. And, you know, there is very, very good reason for taking this issue seriously. If you look at all the major complications, health complications of maternity across the world in rich countries and in poor countries, the really important disabling conditions, mental health conditions, are far more common than any of the physical health conditions, which people are aware of and have, of course, got policies throughout the world and are indeed making investments and taking action to try and reduce. So mental health care, as ever, and particularly in this important area of perinatal mental health care, is getting a really raw deal, even though it is actually the most common, the most disabling, and indeed deadly series of conditions when you compare it to physical health conditions. And we know that actually in poorer countries, you know, mental health isn't a luxury for rich countries. Mental health is even more problematic, more disabling, and more common, or mental health problems are, in low and middle income countries than they are in high income countries. And there are all sorts of reasons for that, including, of course, the poverty itself, but also including what I spoke about earlier, those very early childhood experiences that come from really difficult environments, and that we now know from science, those negative effects of early environments don't just last one lifetime, but are passed on to our children. So we have a heritage, a legacy from previous generations of disadvantage on the mental health, and indeed, actually, via mental health, on the physical health of people. I spoke earlier about the most serious mental health or most high risk and disabling mental health condition we know of, psychosis, which is more common in women after giving birth than at any other time in human existence. And of course, it only happens to women during maternity that risk is so high. And these are also the most severe high risk illnesses that we come across in the whole of psychiatric practice. Now, I've mentioned mums, and there's lots more to say, but time prevents me from doing so. But we also need to consider the effects on children. Very important. These effects are absolutely clear, undoubted, shown in every study, but they are not inevitable in every individual. They are an increase in risk of difficulties, a substantial increase in risk of difficulties if mothers in particular, but also fathers, have mental health problems, particularly early in childhood. And this is just one of the many studies, one of the earlier studies that showed this doubling of risk of mental health problems in the offspring when mothers have had mental health problems in pregnancy, and this also applies postnatally. And remember, a bigger effect than if parents have mental health problems later on, but not an inevitable effect, and even more important, not irreversible. So we can help children to overcome these difficulties. So here's just a quick summary, a quick list, and you can have these slides. And indeed, I think this recording will be available later for you to go back if you're interested, and I hope you are. Here's a list of the sorts of effects on children, not inevitable and not irreversible, but nevertheless very real effects that have been shown to occur in children whose parents, and particularly mothers, are suffering from mental health problems in pregnancy and postnatally. And you can see it's a very substantial list that this research is bringing up. And here's just one example, a pretty dramatic example, when you consider poor child growth, and this is a really important issue in low and middle income countries. This study showed pretty clearly from analysing data from multiple studies done in low and middle income countries that about 30% of the risk of poor child growth can be attributed to maternal depression. So it's not just a kind of scientific quirk. This is a substantial effect, not inevitable, not irreversible, but absolutely there. And the more recent research in just the last few years is showing us pretty clearly that when you consider the effects of an adverse environment on the development of children, such as, if you take, for example, poverty, these effects have been shown for decades now. We've known for a very long time that an adverse environment has an adverse effect on the developing child, but we've only understood very recently, really, from studies, that the way in which, for example, poverty and other adverse environmental effects affects the development of children is through the mental health of the primary caregiver, mainly mothers. So if we want to do something about, of course, we should try and tackle poverty and other environmental issues, but if we want to do targeted work to try and reduce those effects, we need to consider how they are transmitted to the child via the mental health of the mother. So children whose mothers and primary caregivers aren't suffering from mental health difficulties are much less likely to be affected by an adverse environment. And this is a really important issue, particularly for people like you who are so crucially important in trying to help parents of young children do the most difficult task that any of us ever undertakes in our lives, and that's do the best to be good enough parents to young children. And there are lots of ways in which that can be done. And here's a kind of list of what the science tells us about what makes a difference to improving the mental health of those who are suffering from mental health difficulties in the perinatal period. And you can see that there's a list of things, some of which require kind of professional help, but many of which don't require very specialized, expensive, highly trained professional help. And actually the evidence suggests that for many, the less expensive, less highly specialized interventions that are actually based on human relationships are just as effective. It's when you get to the much more severe types of mental health problems that the more expensive, more highly specialized interventions are required. But for the vast majority of mothers, of primary caregivers of very young children, the more low intensity or relationship-based interventions can be extremely effective, both for the mental health of the mother or primary caregiver, but also for the relationship between the mother and the baby. And of course, Homestart and Mellow Parenting are fantastic examples of those sorts of interventions. And there's quite a lot of evidence that you need a kind of combination of both. You need to both help support improved mental health in the mother, but also help to support establishing a more joyful, a happier, a healthier relationship between mother and baby. And this is, again, just an example of an analysis of lots of data from lots of studies, and I'm not going to go into the scientific detail, but just to show you that there is lots of science behind this evidence that there are things that we can do even in low and middle income countries at low cost. And it's not just interventions with individuals such as workers in Home Start and Mellow Parenting are doing with individual families, but it's also what can be done at a population and a political level that can have an impact on both maternal mental health and on outcomes for mothers and families and their children. So this is an example, again, I won't go into the detail, but just to show you that we do have this sort of data from low and middle income countries, that you can do things at a population level that can make a difference. And here are just one example of the simple and cheap interventions that are essentially relationship based, getting people together, getting mums together, getting them, and a good way of breaking the ice of getting people to engage in relationships is to engage in activities, and singing, for example, or dancing are ways of doing that. But any way of engaging in a community and engaging in relationships between members of the family and mother and child and father and child are really extraordinarily powerful. So never underestimate the effects, the positive, beneficial effects that just the simplest things that you're doing, let alone the wonderfully skilled and complex things that you're doing, are achieving for the people you're trying to help. You are fantastically important people, whatever it is you're doing in this field. And tragically, that is not accompanied by governments and policymakers following the guidance that is out there, of which there is plenty. So there's plenty of research, there's plenty of guidance and policy at an international level, including very recently from the World Health Organization about how to go about this. But very few countries, including those with high incomes, are really following through and doing what needs to be done. So that's not a reason for despair. That's a reason to stand up tall and keep doing what we're all doing, but also, in addition to that, demanding more for the mums, the babies, the families the parents and the families that we're trying to serve, and for the populations and the societies that we live in, because the effects go right through society and indeed from one generation to the next. So given that this sort of thing isn't happening, including in high-income countries, including the country that I've been working in health services for over 30 years. How on earth can we achieve change beyond just doing the best we can as individuals? Well, one of the ways is to come together. Probably the most powerful way of achieving big things is to make big relationships. And of course, you all know that because that's what you're doing day to day. But that applies in a sense at a political level, at a big change level. And this is an illustration of the way in which organizations in the UK came together, including, of course, Mellow and Home Start, and many other professional and charitable organizations came together to demand better outcomes and better care for mothers, parents, and babies and families in relation to mental health. And that was extraordinarily effective in the UK. So what did we decide to do worldwide? Well, learn from our experiences in the UK of acting together and demanding together. And for the past few years, we've had the Global Alliance for Maternal Mental Health, which is bringing together organizations. So it's not individuals who are joining this alliance, it's organizations who are either international, working in more than one country, or organizations that are alliances of multiple organizations within one country. So you can see here we have international organizations that work internationally. You can also see that we have alliances like the UK alliance that come from one country but have lots of organizations within them. So if you wanted to join or be part of the Global Alliance for Maternal Mental Health, either participate in a national alliance or in international organizations, or if there isn't a national alliance in the country in which you work, start pulling one together. Talk to people and say, come on, let's just let's get together and call ourselves an alliance. And I'm absolutely sure that Mellow Parenting and Homestart Worldwide in those countries would be happy to participate in national alliances. And those national alliances can then join the global alliance, and together we can be stronger and stronger and stronger. And our vision is, I'm sure, shared by everybody participating today, is that all nations will understand and invest in their human infrastructure by fostering mental well-being and functioning amongst parents, and not just for this generation, but for the next generation as well. And our primary purpose within the Global Alliance at this early stage in our activity is to encourage and foster the development of national and regional alliances, and then to support them to get the very best for mothers, babies, and families in their own countries. So absolutely not for me in the UK, for example, to say what the solutions are for anywhere else, but to provide information, to provide data, to provide encouragement and enthusiasm. And in the past few years, that has led to the formation of alliances around the world, in Africa, in global French and Spanish-speaking countries globally, in rich countries, in poor countries. And that's just a joy to see. And those alliances, there are people and organizations working together in those countries to fight for better results and better outcomes. And you know, in your day-to-day work, and I'm kind of saying this applies at every level, really. If we want great results, we build great networks. We join together, and together there is strength, and together we can nurture and get bigger and stronger. And that's the way to fight for change. And I finish with a quote by Margaret Mead, this wonderful anthropologist, who said, "Never doubt that a small group of thoughtful, concerned citizens can change the world. Indeed, this is the only thing that ever has. And through working on perinatal mental health, you can be those people who change the world." So thank you for listening. I think I might have gone a few minutes over, so I apologize. And I'm really sorry again that I can't be with you today. But I hope you have a really fantastic meeting and you emerge even more enthused and doing and realizing how wonderful the work you do is. Thank you very much.
Well, thank you, Alain, and as always, very powerful and enthusiastic, and giving us good ideas on how we can go forward to build these alliances, which leads us, I think, to the last component of our work today, which is how to put these pieces together from the jigsaw. But people might want to comment on what Alain Gregoire was saying, and pop things in the chat there. But maybe what I'll do at the moment, as part of this process of trying to build our next steps, if you like, what are we going to do moving forward? If I hand over to Rakib and Kirpal again to lead us in this last component, the missing pieces. Well, the last pieces. All right.
Okay. Thank you, Campbell. That, I have to say, that was a really, really interesting presentation. It's very thought-provoking, and it just each of these presentations has just brought everything together about working with families, how important it is to support children at the heart of the work that we're doing, but it is through our families that we're getting through to enable children to have a healthy start in life. Is there any comments? from anybody that wants to put forward anything about the presentation, as Campbell said, or anything that you want to touch on at this point? I know we're running out of time. Rak, did you want to put the slide back up again? The one that we were sharing, or
we could. I think just for the sake of time, because we are slightly over.
Okay.
What we'll do is we'll keep the slide. We'll summarise it.
That's fine.
And we'll send it out along with a copy of the slides and some other information. So I think that'd be good, yeah.
Okay. All right. That's fine. So really, what this last bit is really about: how do we come together? What is it that we want to do? Are there areas of work that we can share? Just listening to presentations today, there is so much synergy. There is so much complement of work that Mellow are doing, that Homestart are doing around the world. But not just these two partners. There were other participants here that may be looking at working with us in a joined up way. And really what the next stage is, what would you like to do? How can we move this forward? Is there an interest? And I know Rosemary mentioned earlier on in the break that Evie from Homestart Greece has been talking about whether we need a similar sort of conference, but for a European angle that looks at the region in terms of how we can come together in the area. So going forward, if there are expressions of interest, if you would like to talk further with Start about our work, please reach out to either myself or to sort of Rachel in Mellow Parenting, so that we can take it further. We can discuss with you. We can look at what you would like to share with us and how we can move forward. Any questions at this point? No? On my internet? No? Otherwise, I'm very happy to conclude and say that this has been a really fantastic experience, a really excellent conference. And no doubt we will be sharing a lot of information in the coming weeks with you. Also, what are you taking away from today? What is it that really has struck? Certainly, a number of things that came through was about partnership, was about the global reach of both organizations, the risk factors involved in mental health. I really was interested, and I think a lot of people mentioned the fact about the intergenerational mental health, the impact on children, so important, and how can we approach that? How can we look at that? So I think there's some really interesting things to take away. Sorry, go on, Rak.
That's okay. Just while you're sort of summarising, which is very, very, very interesting and helpful, and I didn't want to interrupt. But if we could just, whilst we're doing that, and encourage everyone to have a think about what they're taking away and just using their Mentimeters, just throw in a couple of ideas. Oh, there we go. Yeah. Just like that. So put in a few ideas using the Mentimeter and what they, key things that they feel like they want to take away from this conference today, and that would be really helpful. Yeah. Thank you.
Yeah, thank you, Rak. So I completely forgot the Mentimeter. That's why. So sorry.
Yeah, pal, we actually have a question from Deborah, Homestart, Northern Ireland. Mellow Parenting could possibly facilitate training facilitator courses specifically for Homestart schemes UK and worldwide.
Well, Rosemary, you're already working with a number of home starts in the UK, and it's something that's why I reached out to you in the first place. That I see that is something that we certainly, Mellow Parenting and Homestart Worldwide, are looking at. How do we bring that training together, and how do we share it with our partners around the world in Homestart? So yes, we are looking at that. I can't answer that at this point because I really need to discuss this with Rosemary, how it would go forward. But it is something that we will be looking at to take the next steps. So Deborah, keep an eye on what we're doing and share it with Homestart UK as well. Thank you. Was there anything else? Anything else that we need to?
I'd just like to make a comment from the WAME perspective, if I could.
Yep.
As I might have mentioned earlier, WAME is an international organisation. I think we've got 75 affiliates worldwide. And it may be that our affiliates and organisation could be another vehicle for disseminating the learnings from and the strategies from Mellow Parenting and the collaborations, like the really important collaboration with Homestart. And if people are interested in doing that, to let me know, and we'll continue a dialogue about that. We also have a number of training things online. There's a series of webinars online that's available to groups and individuals that we did in conjunction with Infant Mental Health Promotion out of Sick Kids Toronto in infant mental health, with a lot of key researchers and clinicians and agencies contributing to that. And we've also got our World Congress in Dublin coming up. So, and I know there's some colleagues from Mellow Parenting who will be presenting there. And that's in the middle of July in Dublin. So if anyone wants more information about that, I think I'll put a link to our website in the chat there. But
thank you, Campbell.
Collaboration with other organisations who've got networks, as Elaine was saying, I reckon is really important, and happy to participate and support that.
That's really encouraging. Thank you so much for that. There's a question in the chat. Leanne Graham says, could parents who have taken part in Mellow Parenting courses become Homestart volunteers? Absolutely. Please, please, please look in your area, look in your region. If there is a Homestart nearby that you can contact. That is the whole idea of this program, that we're sharing knowledge, we're sharing information between each other. And as Campbell says, this is how we should be working, looking at the network. How do we extend this between ourselves, sharing that information, sharing that knowledge and upskilling. So absolutely, if there is a Homestart near you, Leanne, and there are parents that have taken part in Mellow Parenting, please your local Homestart. Or in the case of Scotland, there is a Homestart Scotland. Please contact them, and they will forward you to your nearest Homestart in Scotland. Okay. Thank you for the World Association of Infant Mental Health link. Thank you for that. Anything else? Anybody got anything else? Rack, have we finished with the Mentimeter, or is there more on that? That's it? Okay.
Yeah, I think that's us done with the Menti. So
okay. Is there anything else that you would like to add before we finish?
No, I think everybody's done a phenomenal job. There's not much for me to add apart from a huge thank you to everybody who's taken time out and for your patience for running a little bit over. A huge thank you to all our presenters and everybody that's organised this in the background. And I've thoroughly enjoyed it. I'm really excited to see where we go forward with this, and I look forward to hearing from everybody who's been participating today to see how Homestart Worldwide and Mellow can support you going forward in your own local countries. Very exciting. Thank you.